Let's dive into this week's top stories. A major ransomware attack affects hospitals in 6 states. Ardent Health Services was the target of a ransomware attack over Thanksgiving weekend. The attack affected hospitals in Texas, Oklahoma, New Mexico, Kansas, Idaho, and New Jersey. Ardent Health Services was compelled to shut down its entire network to contain that attack. The full extent of the attack's impact and the compromised data is still under investigation. As of today, most patient services have been restored. The Office for Civil Rights settles a phishing case affecting nearly 35,000 patients. The OCR announced a settlement with Lafourche Medical Group. The phishing attack happened in March of 2021 and was reported to the HHS 2 months later in May. The HHS says someone hacked into an email account containing electronic protected health information, putting sensitive individual information at risk. Lafourche agreed to pay $480,000 to the OCR and will follow a corrective action plan. The Illinois Supreme Court rules the state's biometric information privacy law does not apply to healthcare workers if used in a HIPAA-compliant capacity. 2 nurses sued their employer, Ingalls Memorial Hospital. They say the hospital's use of fingerprint-enabled medication storage violates the Illinois Biometric Information Privacy Act. Under HIPAA, people must be notified if their fingerprints are collected or stored. It's one of the strictest laws regarding biometric information. The hospital argued they were exempt from HIPAA because stored biometric information was required for healthcare treatment, operations, or payment, and therefore protected under HIPAA, a federal act superseding state provision. An appellate court sided with the nurses, but the Illinois Supreme Court reversed that decision. It ruled in favor of the hospital, saying HIPAA allowed the hospital to collect employee biometric data without notifying employees. In other news, following increasing and evolving cyber attacks, the Biden administration releases a concept paper building on last year's national strategy. The document, released on December 6th, focuses on cybersecurity in healthcare and what steps should be taken to address challenges. According to the HHS, which tracks cyber incidents in healthcare, there was a 93% increase in large breaches reported between 2018 and 2022. Even more alarming is the 278% increase in large breaches involving ransomware. More in the link below. And did you know HIPAA does not directly impact pharmaceutical sales to physicians? However, regulations and laws within the healthcare industry affect how pharmaceutical companies interact with healthcare professionals. More in the link below.